They talked about a follow-up ultrasound at 1 day, 1 month, 3 months, 6 months, and 9 months. Okay? I know that's tricky to get, although you're blessed in Alberta. You're getting ultrasounds better than almost anywhere in the country. The only other place that it's possible is probably in the clinic in Barrie, Ontario. They've recently started one in Winnipeg, and of course at False Creek in Vancouver. But they're tricky to get. And if you have MS, you can't get a referral for them. This is absolute nonsense. But I suggest we're going to need to educate the medical people, especially the family docs. Because if we take the angst out of it with the knowledge, get in touch with your College of Physicians and Surgeons representative. Sure, that's the licensing body for physicians. Currently they're being fear-mongered into saying that this is risky. It's not. However, on their board, they have a third to half of their board are lay people. The lay people and the College of Physicians and Surgeons are there to look after you, the patient. That's their job. So we've got to approach those people rather than some of the echelons. It's a tricky job working on the political side. You know, I'm happy to be introduced in the Alberta legislature tomorrow. But, you know, as Kirsty Duncan has said, the political system has failed us at the national level. I'm really, really hoping that she gets re-elected as a Liberal MP in Ontario, because she and some of them are getting it. It's been really tough sledding nationally. Provincially, you're going to have some work too in the same venue, but I think the changes will start to happen. There's got to be extra pressure on the government here after Saskatchewan's had $5 million in the coin-op for a while. Manitoba just joined last week with another $5 million. You know, I realize times are tough in Alberta, but maybe they're going to get better. Kidding. Okay. So, when should I go for my CCSVI treatment? Well, I would urge you, sooner is better. Why? Because every day you have that poor blood flow out of the brain, and you get the back pressure in, you're increasing the brain injury. Remember the term slow stroke. Well, if you have a stroke, you've got 3 to 4 hours to get to the emergency room, and they may dissolve the stroke that's on the artery side. This is one that's been there probably since birth. Many of these venous malformations were there at birth. That's probably the best guess so far. But they take years to develop. Sometimes they develop, there's young people as young as 5 with multiple sclerosis now. And I've seen people that were 11, all right? This can be a young people's disease, and it often is. That's the tragedy. It's people in their 20s, 30s, 40s, at their peak of their life. And it's mostly women. That's unfortunate. It used to be 2 to 1, now it's closer to 4 to 1. We've got to solve this. It's hurting families, careers, and communities. And we have a solution now to make a profound difference. So the other part about getting treated, it will reduce your risk of dementia. My greatest fear with my own MS is becoming demented. It happens in 10 to 15% of us. I felt good when I had my MRI. I still didn't have any brain shrinkage. Eventually brain shrinkage occurs and the brain atrophies, gets smaller. It's hard to reverse some of those pieces. The sooner you treat it and establish healthy circulation to the brain, you'll have less dementia. Some brain injury may not be reversible. That's only fair. The other piece I want you to think about, though, when I talked the other night in Victoria, and it was a joint meeting between the National CCSVI Society, and I'm on the board of directors of that. Some of you got a brochure on the way in, and it's a place to go to see most of these talks, and I'm hoping this one will be posted there too, all right? But you can get the talk that was in Winnipeg that some of you have watched, and all these other sorts of issues. It's a place to stay current. But it was jointly held with the MS Society. It's time to heal the injury. You know, Alberta's way ahead of the game. You had the apology in the country first. So good for you. and good also for the other folks that are now on the MS division, Alberta Division Board. It's fantastic. The MS Society can help us hugely in the rehabilitation game. Those of us that have some brain injury, and I'm in that group, okay, we have to rehabilitate. If we've been in a wheelchair 10 or 20 years, it's a long road back, but there is a road back. Because once you restore blood flow to the brain, you improve the plasticity of the brain. Plasticity is something where the brain adapts new pathways when one pathway or part of the brain's been injured. Great example is stroke. I'm sure you've all seen someone with a stroke. Almost everyone with a stroke can learn to talk again. It's not easy. It's a lot of work. Do they get the injured part back? No, they don't. They train new pathways. It's the same. If the pathways aren't working that move your legs and move your arm, you can train new pathways. And you can do that. I also know what it's like to be fatigued. You haven't got enough strength to get barely out of bed. How are you going to get excited about rehab? But once you've turned that corner, the fatigue is gone, the road back is possible. And I've seen people work at it step by step. You watch them on Facebook, so have I. Some of us are lucky. We've been in a wheelchair and we almost jump off the table after venous angioplasty. That happens maybe 1 in 10, I hope, but maybe 1 in 20 times. The rest of us have got to work at it. The brain can do healing. When you improve the blood flow, myelination probably recurs. And you can train newer pathways. But there's going to be work with it. So teaming up with people with a superb rehabilitation medicine specialist is one venue. The other is the physiotherapists. Another is a really good physical trainer. Physical trainers for years have been helping people after their back surgery, their stroke, or even their MS. Find one. I know that there's a few good ones anywhere where you live. I live in a little town of Duncan on Vancouver Island. I went to the physical trainer that my wife's been helped, and she helped me huge with my balance retraining. My drop foot was retrained away. Your drop foot, if you have one, probably won't disappear just because you have the treatment. You may have to do some rehab and retreat it. But drop foots happen after back surgery too. You can retrain stuff. And I think that's, the picture of course is brain cells. We may have lost a few, but we have a lot of backup ones, which is good. So MS is the poster child at the moment for CCSVI, but it's bigger than that. It's things like transverse myelitis, optic neuritis, normal pressure hydrocephalus, benign fasciculation syndrome, and leukocytosis. Most of those you won't have heard of. But they're all circulation related, okay? Because of problems in the venous circulation. But now they, just like us, have some more hope. Let's go on another one. So if you look how many people in the regular population, the early studies talked about 20%. But we've now found that those studies were flawed. The big study out of Buffalo was about 20% in the normal population. The problem was, they took many of their patients were family members of people with MS. Because they've got access to them. They've already got the MS people there. They're looking for normal volunteers who are terribly interested and dedicated. But I would suggest part of the familial issue with MS, remember I've got a sister, my risk was 5% of getting MS when she had it. Okay, it's at least 2 or 3% in an immediate generation relatives. So my son or daughter, my mom and dad, my sisters and brothers. Okay? 2 of us having it goes up even higher, quite a bit higher. And I would suggest to you, a lot of it is venous variation within. So when they looked at 300 people that had very extensive CT scans, huge radiation risk, but they got great pictures, okay? They went back and looked at it in the normal population, and it was in the 250 that they could actually study, 7.5% of them had CCSVI. So what does that mean for that group? Well, I suspect that group should think about it, because they're going to be at risk, I suggest, to neurodegenerative diseases, and I've listed some of them there that you will know. Parkinson's, dementia, including Alzheimer's, ALS or Lou Gehrig's disease, and recurrent or high stroke risk. Remember, I was in stroke research. Well, I can't think of a better guarantee of doing badly with a stroke is you have a stroke and you already have untreated CCSVI. It's a lousy combination, folks, so that's why I want us to think about that part. I still honestly believe the stroke neurologists are going to come on side first, because they understand the concept of circulation. They just aren't into the venous world yet, but I think we'll eventually get them there. Okay. So this is further to a study that was done by Dr. David Hubbard, a neurologist, although he was given neurosurgical status in the Maclean's magazine that was listed online. I'm sure David will get a kick out of that. I'm down to his conference on the 14th of May in San Diego. But he did a study with functional MRI. And he found, as they studied the venous waves out of the brain, that they differ in those with MS and the normal population. However, and it was slow, the blood takes longer to get out of the brain if you have CCSVI. Stands to reason, right? You got back pressure. Things are slowed down. However, when they tested them the next day, the MS people, after venous angioplasty, their waves in transit time were normal. It's hard to placebo something like that. Very hard. Okay. The keynote speaker at the conference was Miroslav Slakovic. I didn't do that right, probably. Brilliant man from New York. He also was a very mean opera singer. He did opera on the bus. They took us out to Pavarotti's home, which is now a facility, one evening, and Pavarotti wasn't there, of course, because he died some years ago. But we did see the bed that he died in, and we saw lots of his garments, and they had an impromptu, where they had organized a tenor, and this fellow sung as well. He talked about Alzheimer's and what were the neurovascular mechanisms in neurodegenerative diseases. He talked about Alzheimer's being a two-step process. And the first step is vascular damage. So sure, some of those are going to be strokes on the artery side, but some of them could well be CCSVI issues causing that first step toward Alzheimer's of vascular blood vessel damage. And then you go on, of course, to the one we know better, amyloid beta peptide amplifies the injury of number one. Excess iron in MS, we're just at the threshold of learning this. Mark Hakey, the physicist I mentioned earlier, has really moved things forward with his NMR or MRI imaging with regard to iron. I had my initial one in Buffalo with the technique there of Dr. Zavadinov and others, but then I had my follow-up one when I went back with my sister 3 months after my procedure. I had an MRI, MRV. The MRI, MRV, of course, gives you a much better look, and if you do it with the Hakey protocol, it gives you flow characteristics. So you learn more about the flow within the veins, so they learn more. It also gives you a very precise measurement of how much iron you've got in your brain. I don't have the slide up today, but short story is folks with MS have more excess iron in the brain than regular people, and I have even more than that. It goes up in all of us as we get older, but even if you age corrected, it's an issue. We're going to continue to tease this part of the puzzle out and what makes a difference to it, but it's early days.